What is heart failure? Heart failure is not the same as heart disease. It occurs when the heart gradually becomes weaker and starts to fail due to blockages within the arteries, restricting enough blood supply to the rest of the body. What are the signs and symptoms of heart failure? It is characterized by symptoms such as swelling ankles, weight gain, dizziness, coughing, and the loss of appetite. Heart failure is also known to be caused by other conditions such as HIV or AIDS, infections, cardiomyopathy, lung disease, and alcohol overuse. The World Health Organization has declared that heart failure is the leading cause of death globally, with statistics resulting in 15.2 million deaths in 2016. For example, a 76-year-old male patient with systolic congestive heart failure suffered severe hypertension after receiving 2 doses of Sacubitril/Valsartan, and within 11 days the patient passed away. However, in a different study with larger sample sizes of patients with chronic systolic heart failure, ages 55 to 65 with class 2 and 3 trials showed better results as most patients had increased life expectancy rates. Existing recommended drugs for heart failure include enalapril and Entresto. The overall outcome for the comparison of Entresto and enalapril resulted in 21.5% of deaths from Entresto and 26.4% from enalapril. The outcomes of death from cardiovascular causes resulted in 13.3% of deaths from Entresto and 16.5% from enalapril. On the other hand, deaths caused by hospitalization from worsening heart failure resulted in 12.8% of deaths from Entresto and 15.6% from enalapril. Entresto was approved by the FDA in 2015. The pharmacodynamics of Entresto. Sacubitril is an antihypertensive drug, but in recent studies, it is now being used as medication for heart failure. It inhibits neprilysin by enhancing natriuretic peptides through increasing natriuresis. Sacubitril works by increasing proteins in the body that widens the blood vessels to help lower blood pressure by reducing sodium levels. Whereas Valsartan, an angiotensin receptor blocker, also known as an ARB, keeps blood vessels from narrowing through the inhibition of the renin-angiotensin-aldosterone system, also known as RAAS, which lowers blood pressure and improves blood flow. A research carried out by Cerrone and Mabasa concluded that the remittance of heart failure patients could be caused by the overproduction of natriuretic peptides. Who is at most risk when taking Entresto and who shouldn't take it? Pregnant women shouldn't take it, as well as people with diabetes, the kidney disease, and liver disease. What is the pharmacokinetics of Sacubitril and Valsartan? For taking the ADME approach, for absorption, Entresto is taken orally and is absorbed through the renal system, where the metabolite LBQ657, also known as neprilysin, is activated. The distribution of both Sacubitril and Valsartan occur at the blood-brain barrier where the level of plasma protein binding is very high. It was found that Sacubitril bound preferentially to human albumin rather than to glycoproteins. The metabolism of this drug occurs at both the liver and the kidney of the human body. The excretion occurs both through the feces and the urine. The common side effects associated with Entresto includes feelings of being tired, regular coughing, feelings of being dizzy, as well as kidney problems such as painful urination. The social and clinical impact of Sacubitril/Valsartan on heart failure is the price. Entresto costs roughly $12.50 per day compared to other options such as enalapril costing 13 cents per day, making it more expensive. It allows fewer hospital admissions as well as increasing life expectancy for patients. Treatment for heart failure include prescribed drugs, regular exercising, lifestyle changes such as eating more fruit and vegetables and eating less salt. Although the cost for the Entresto treatment is more expensive, studies show that patients who undergo this treatment would reduce hospital fees, hence proving that this treatment is both effective at reducing cardiovascular death and heart failure whilst being cost efficient.